under eye bags, under eye tear troughs, under eye hollows, under eye dark circles, under eye fine lines and wrinkles. Why is it the under eye area is the first to show our age? It's the most commonly sought after treatment area when I see patients every day in my office. In this video, I'm going to be illustrating and going through different changes that happen under the eyes and different things that we can do in and out of the office at home to help combat these changes and make the under eye look its very, very best. In last week's video, we talked about perimenopause and postmenopausal changes. We also talked about in previous videos different collagen boosting treatments at home and in the office. So if you haven't checked out those videos, be sure to watch them. But after posting those videos, I had a lot of questions and comments from you guys asking about treatments targeting that under eye area more specifically. And although I've done videos on this topic in the past, the data is constantly being updated and new discoveries are being made in aesthetic dermatology. So I want to keep you guys in the know and tell you about the latest and greatest treatments that we can do to help rejuvenate the under eye area, which is the most problematic area for most women. I always like to start by saying that it may be not just one or two changes, it may be 3 or 4 changes or different changes that are happening under the eye that require different treatments. Each individual patient is unique and it may be a combination of treatments to help make her or him look their very, very best. So I always want to start with talking about anatomical differences under the eye that may be contributing to looking tired or old or sickly, or like you have dark circles under your eyes. And then sometimes you may have great under eye skin or great under eye area as you go through your 20s and 30s, and then you start to see some changes happening in the 30s, 40s, 50s, and beyond periods in life. By addressing these different issues, hopefully you'll understand your particular changes or anatomical variants and what treatments may be best for you. And again, it may not just be one treatment, but rather a combination of different treatments over time. The 3 most common changes that happen under the eyes, now again, this could be anatomical, something that you're born with, or it could be something that presents itself in your later years in life. Now, first of all, you have volume loss, or there can even be not a loss of volume, but a topography difference where we call there's a hill-valley hill, where there's not a smooth eyelid-cheek junction and where there's a little bit of a deficit that can make our eyes look sunken or make what we call tear troughs look more apparent. And filler isn't always the answer. I know that this is the go-to treatment that everybody talks about online, but filler is actually not my favorite treatment as an aesthetic injector and as an aesthetic dermatologist, because sometimes it has to be the right patient getting the filler for the right reason. If someone has a volume loss or a little tear trough there where the eyelid cheek junction isn't smooth, then filler can be beneficial. But there's PRP, there's PRF, and now there's Easy Gel, which I'll talk about later in this video, that can help rejuvenate that area. If you're using filler to stretch out fine lines and wrinkles, that's not the treatment of choice. Fine lines and wrinkles happen from collagen loss and a loss of elasticity, a loss of extracellular matrix proteins in the skin that can give that skin a thin, wrinkled, textured appearance. Yes, if you put filler in that area, you're going to temporarily stretch out those fine lines and wrinkles and make them look smooth, but that's only about 6 to 12 months duration for those results. And then what happens? The wrinkles come back, and then you do more filler, and then they come back again, and you do more filler, and then you keep doing more and more and more filler under the eyes, and then you start looking distorted, or like those influencers and celebrities that just don't even look like themselves, and they have those overfilled pillow faces. We want to deter from that. We're going away from that overfilled look that was happening 3 or 4 years ago. So it's really important to understand the changes that are happening. If you have a tear trough or if you have volume deficit, then maybe doing something to add a little filler will be beneficial. However, if you're doing filler for the wrong reason, for the wrong indication, and I want you guys to think like doctors, I want you guys to think like practitioners. If you're trying to smooth fine lines and wrinkles with filler, that's just a recipe for disaster. So how do you smooth fine lines and wrinkles? Tightening devices, laser resurfacing, anything that's going to boost collagen and boost elastin stores in the skin to help smooth and tighten the skin is going to be beneficial. Now, it may be a combination of treatments like thermofrax, where we combine Thermage and Fraxel for a 1 + 1 = 3 synergistic effect, because you're getting full thickness collagen stimulation. We've done other videos on the past on some of the negative side effects of energy-based devices and sometimes lasers when in the wrong hands. But it's just that, you guys. You have to have a highly trained, skilled professional for the best results and for minimal complications complications and minimizing bad outcomes. So we've talked about volume loss or tear troughs or hollowing, which we can restore with volume, whether that be a filler or an easy gel or even PRF or PRP, which I'll talk about in a minute because there's some downsides to those treatments. We've also talked about collagen stimulating or boosting treatments like energy-based devices. Now this could be Ultherapy, it could be Thermage, it could be Softwave. Elocore is a microcoring technology that doesn't really use heat or energy to stimulate collagen. Rather, it is a microcoring technology that's more used for lower face rejuvenation. A lot of people ask me for Elocore for under the eyes. It's actually not indicated for under the eyes. I'll talk about that in a different video, but for all intents and purposes of this video, laser resurfacing and energy-based devices, or a combination of the two, give next level results because they stimulate collagen, they thicken the skin, they smooth the skin, and they tighten the skin. Again, you don't want to use volume to correct fine lines and wrinkles. Sometimes patients will come in and they'll have a combination of both. They'll have some volume loss or they'll have some hollowing and they have fine lines and wrinkles. And in that situation, we may do a little bit of filler and we'll do some laser resurfacing. Now, depending on the severity of the laxity or the fine lines and wrinkles, we can do non-ablative or a combination of ablative, non-ablative, or fully ablative lasers. There's a whole continuum and a whole spectrum of levels of aggression when it comes to resurfacing lasers, and we'll talk about that later as well. Another change that can happen under the eyes is the skin thins and can show that underlying vasculature under the eyes, which makes it look like a blue-purple discoloration that can make us look sick or tired or old. V-beam is my very favorite laser for that area, and usually it takes about 2 to 3 treatments spaced 1 month apart, and we basically just use it to brighten up the under eye area, and it works wonders. Women that have to rely on concealer for hiding those dark circles love it because after doing V-beam 2 or 3 times, it just brightens them up and they no longer need the concealer to hide those dark circles. A lot of patients will ask me, how much do I have to do this? What's the maintenance like? Is it going to be just cured forever? It all just depends on your underlying genetics. I would say on average, patients can go 2 or 3 years before they need a little touch up, and then maybe they'll come in every few years for 1 V-beam treatment under the eyes to keep their dark circles away. If someone comes in and they have dark circles from volume loss, sometimes we'll do a combination of easy gel or filler in combination with a V-beam. And if they have some fine lines and wrinkles, then we'll do a little resurfacing or thermofrax under the eyes. It all really is patient by patient dependent on a customized treatment approach for rejuvenation of the under eye area. And sometimes surgery is just necessary. Within my scope of practice, I do not perform lower eyelid blepharoplasty, where they basically take the fat pad and they reposition it, and they sometimes do a skin pinch where if you have a lot of excess skin under the eye, they'll do a little incision under the eye to remove that excess skin. But you always want to go to an astute plastic surgeon or oculoplastics, because if they take too much, you can have an ectropion where your eye looks like this, or you can have some really bad complications. So if you do need surgery, make sure that you're going to a highly trained plastic surgeon or oculoplastic surgeon who you trust, who you've seen their before and afters. Don't be afraid to get a second, third, or fourth opinion. It's your eyes, you guys. It's your face. Let's talk about Easy Gel, because that's getting a lot of hype on social media and actually at our academic meetings too. So Easy Gel takes your own platelet-rich plasma or your fibrin-rich plasma, and you reconstitute it and you mix it with some type of biostimulatory component like albumin, or there's different companies that make different types of biostimulatory components that you can fix with the patient's platelet-rich plasma or fibrin-rich plasma or platelet-rich fibrin. And what happens is you inject it into the under eye area, and it stimulates growth factors, and it stimulates collagen synthesis, elastin synthesis, and it typically lasts about 3 to 6 months. So unlike filler, when you put filler in the tear trough area, Vobella, as far as my knowledge, is the only FDA-approved filler for the tear trough area, although other low G prime fillers are used for tear troughs. Usually tear trough filler can last 2 or 3 years or even more. But again, you guys want to go to an expert injector who's not going to overfill you, who's going to use a cannula that has the most effective safety profile and low complication rate, which won't cause as much bruising or swelling, and God forbid complications. That risk gets decreased by using a cannula. So filler will last about 2 to 3 years, whereas Easy Gel's a little bit safer, may last about 3 to 6 months. Now, up to this point, I haven't been a big fan of PRP or PRF under the eyes because it doesn't really last that long. It's a safer injection because a lot of people are afraid they're going to inject it into the vessels. So if you inject just pure PRP or PRF into that area. If it gets into the vessel, well, it's supposed to be in the vessels anyway. It's not going to cause any complications. The problem with PRF and PRP that I've had as an injector years ago when it was first launched, when it was a brand new treatment option, this was like probably like 6 or 7 years ago, it wouldn't last that long. And patients would be like, this is great, everything looks beautiful, but a lot of it just had to do with swelling. And the PRP and PRF has an affinity to be in the blood vessels. And what that means is if it gets injected into the blood vessels, yes, it's safe, but it wants to be into the blood vessels. So it usually gets carried away and circulated away by going into the blood vessels and getting drained out of the treatment area. And then you don't have the lasting effect of the treatment in the first place, and you're left with the tear troughs or under eye hollowing that you had when you initially went to get treatment. So that's why I haven't been a fan of it so far. However, I've heard great things at our academic meetings, among speaking with my colleagues when we go to our Dermatology Academy meetings, in our derm literature, and Easy Gel, or a combination of a biostimulatory component mixed with your PRP or PRF, has shown a lot of promise. And actually in my office, I'm going to assess on some of my loved ones and family members, because usually I treat my family members and loved ones first with, of course, informed consent, and see if it's really getting the hype that it's getting among the community. So I wanted to test it out in my office at first, and I'll report back to you guys if I do or do not like the PRP or PRF Easy Gel when you mix it with albumin or a biostimulatory component, because I feel like it might make it a little bit longer lasting. Now, does it last 3 months or 6 months? It's hard to say, but I'll be able to report back to you with my own anecdotal data. Let's talk about neuromodulators for under eye fine lines and wrinkles. Now, using Botox or Dysporters or whatever neuromodulator that your injector uses, you can help with fine lines and wrinkles to a certain extent. You guys, this is a very advanced injection technique. You can have complications if it's not done correctly, and the complications include an ectropion, where your eyelid margin doesn't even touch the globe of your eye, which can cause a corneal abrasion or corneal ulceration. You can have lacrimal gland activity dysfunction, to where you can't drain the tears from your eyes because it relaxes those muscles so much that smooths them, and yes, your fine lines and wrinkles look better, but your eyes are completely tearing, and your lacrimal gland suction isn't able to drain your tears into your nose, which is the natural course of action. So just be careful. There's jelly roll Botox that goes right under the lid margin and the mid-pupillary line, but very small amounts of neuromodulator are needed and indicated. And even myself as an injector, I only treat a select group of patients for this indication, because sometimes people are not anatomically set up to handle a neuromodulator there, and they're going to look like this or walk around with one eye shape different than the other, and it looks horrible. But for the right candidate, it actually can do a lot. So neuromodulators, we talked about fillers or Easy Gel, biostimulatory fillers. Now, a lot of people are going to probably say, hey, can you use Sculptra or Radiesse or other biostimulatory fillers under the eyes? It's not usually indicated in those areas. I wouldn't use Sculptra here. I would not use Radiesse here. And the only biostimulatory filler I probably would use there is an Easy Gel formulation when it's mixed with your own blood products. Peels are another great way to help rejuvenate the under eye area. Now, there's a lot of talk about phenol peels at our academic meetings. As a dermatologist, I actually don't usually do phenol peels. They're a very strong, deep peel, and I know a lot of oculoplastics colleagues of mine perform those procedures. I don't do them in my office, but I've seen great before and afters with phenol peels. TCA peels, glycolic acid, and mixture of different peels can actually help rejuvenate that under eye area. As with anything, when you combine a peel with a laser, of course you have to be in the hands of a clinician who's very well versed with lasers. Sometimes they work synergistically really, really well to help rejuvenate the eyes. When it comes to lasers and peels, you have to be very careful, because the theory is peels will usually take away that dead stratum corneum layer on top, and actually sometimes even the more superficial layers of the skin. And then after that, you use a laser resurfacing device to stimulate collagen in the deeper skin structures for more profound results. But with more profound results also comes more discomfort and more downtime. So usually if you're getting this in the office of a plastic surgeon, they'll have some type of sedation or anesthesia to help make it very comfortable. In my office, I don't usually combine peels and lasers. I actually don't usually do peels for under the eyes because we have such amazing lasers in our office. I would way rather do a CO2 or a Fraxel or a Thermofrax for my under eye patients than just doing a peel alone. But that's not to say peels aren't a great treatment for under eyes. Okay, laser resurfacing for under eyes. This is the gold standard. Now, I've been doing Fraxel under my eyes since I was in my early 20s in medical school. I feel like it's one of the best things that I've done. done now that I'm in my late 40s because it just helps stimulate collagen synthesis and keeps the skin chock full of collagen and elastin over time. Because again, that skin is thinner than other areas of our face. It's histologically different with different glandular components than other areas of our face when it comes to looking at skin under the microscope. Now, when you talk about lasers, there's non-ablative, which are a little bit, I hate to use the word weaker, but they're less aggressive. There's a combination of ablative, non-ablative, then there's ablative, and then there's fully ablative. CO2 lasers or erbium are the most powerful ablative lasers on the market in today's aesthetic world. CO2 is probably my favorite treatment for laser resurfacing under the eyes. 1 to 3 treatments spaced 1 month apart gives amazing, phenomenal, beautiful results for before and afters for people who need under eye smoothing and rejuvenation. Sometimes we just do a non-ablative, which can actually do a lot as well. Fraxel Restore, also known as Fraxel Dual, we use the 1550 nanometer handpiece part of that laser to help resurface and to help stimulate collagen in that skin that helps give beautiful results. We usually need an intraocular eye shield to do these lasers. Now, not always. And education is everything and knowledge is power. I want you guys to understand why sometimes providers do and do not use intraocular eye shields. When you're going close to the eyelid margin, you always need an eye shield in. Sometimes if you're doing a full face treatment with a laser, you can have the external eye shields or the goggles that go outside of the eyes. But when you're going really close to the eyelid margin, you have to have an intraocular eye shield in. And usually we put numbing drops in the eyes and we insert the eye shield. When we do thermage, we use a special handpiece, which is indicated for that delicate, thin eyelid skin, and we need an intraocular eye shield for the thermage treatment as well. Now, thermage is not a laser, it's not light, it's not photons, it's actually an energy-based device that uses heat in the form of radio frequency to stimulate collagen, but we also need an eye shield for that. And the eye shield is different for thermage than it is for like a Fraxel or a CO2. So if people are getting both treatments done at the same time, same day, which we do all the time, we'll have to put in a certain eye shield, do the thermage, take it out, put a different eye shield in, and then do either the Fraxel or the CO2 on top of it. Those results are next level. Those results are amazing. And if someone's used to wearing contacts, it's like having a big contact lens. A lot of providers won't offer this service. I've had patients come to see me and they say, my provider says that you can't laser under the eyes or you can't thermage under the eyes, and that's simply not true. It's usually because either they don't have the right handpiece, because the eyelid handpieces are different than the handpieces that you use to treat other areas of the face or like the lower face, or they may just not know how to put in an eye shield, which happens a lot too. So just be wary of that. If they don't recommend a treatment under the eyes, question why and try to find a provider who's more comfortable and more well-versed and highly trained in treating periorbital skin. I know you guys are going to probably ask me about threads for under eye fine lines and wrinkles. Thread lifts are great for lower face rejuvenation, neck rejuvenation, and other areas, but under the eyes, smooth threads can sometimes be used, but they're honestly not my favorite treatment because sometimes smooth threads, you can see them underneath the eyes, and the collagen boosting capability doesn't even come close to a laser or energy-based device. But yes, you can use PDO threads for eye rejuvenation. Things that you can do at home to help rejuvenate the under eye area. Like I said before, that under eye area is different with respect to the histologic component, the cellular component of that skin. So active ingredients and vehicle delivery systems for under the eyes are different than those needed for other areas of the face. If anyone tells you differently, they're probably not highly educated in this area, because once you go through derm residency and you spend decades looking at skin under the microscope, you histologically see the difference. And then when you do assays looking at different skincare products, under eye serums, and the vehicle delivery systems and how far they penetrate depending on the technology, there's an astounding difference between updated technology and technology that's not indicated for the under eye. And I spent years looking at skin under the microscope and assessing these and doing trials and testing these different assays and different products of different vehicle delivery systems, and can tell you it is very, very important because, again, that under eye area is different. It's thinner. It lacks certain glandular components. It has different glandular components than other areas of the skin. And for example, under eye serums usually want to have some key active ingredients: niacinamide, hyaluronic acid, green tea polyphenols, caffeine, polypodium leukotomas, DNA repair enzymes. So eye serums usually want to have different components that are going to treat not only fine lines and wrinkles, but under eye puffiness and congestion and under eye dark circles. So that's where the green tea polyphenols, the caffeine, the niacinamide, and a vasoconstricting active ingredients can help make the under eye look better simply by decreasing the puffiness or infraorbital edema and by actually vasoconstricting and clamping down on those blood vessels so that the under eyes don't look so dark or dusky or tired or with that blue-gray discoloration. So certain active ingredients, those are what you want to look for in an eye serum. And I engineered my ECM eye serum by MDAiRE. That was actually the first product that I engineered because I felt that there was a lack of a good under eye serum. Even with some of my favorite top medical grade skincare products, they didn't have a really good eye serum. And I'm actually not a huge proponent of using vitamin C or retinol or vitamin A derivatives under the eyes because that skin is different and it can cause post-inflammatory hyperpigmentation and make things temporarily worse. So I usually rely on more actives that are going to plump up the skin through hydration, minimizing transepidermal water loss, and vasoconstricting and taking away that infraorbital edema by eliminating some of that under eye puffiness and the vasodilation that can happen under the eyes. And by doing that, you can definitely make the eyes look better without even having any in-office procedures. I actually have had a handful of patients who came in to see me and we were getting them on the books. I have a little bit of a wait to try to get in for resurfacing with a laser. And in the meantime, I started them on the ECM eye serum by MDAiRE, and they actually canceled the appointments because they didn't even need the laser resurfacing after using the skincare products, which makes me actually very happy. So what you do at home can be really great too. If you're on a budget, I'm sure you guys have seen this DIY, putting tea bags or cold compresses under your eyes can also help minimizing dark circles and under eye puffiness and swelling that you might get after a late night out, or when you wake up in the morning you have some of that under eye swelling. So those are some little at-home key components that you can do as well if you're on a budget and don't want to get medical grade skincare, or if you don't want to go in and have an in-office procedure. Things to avoid for under eye treatments: at-home derma roller pins and microneedling under the eyes. I cannot tell you how many times I've seen people with thinning of the under eye skin and, more importantly, post-inflammatory changes under the eyes. I've had several patients who are trying to do a good thing, who are younger and trying to be proactive in doing like a at-home microneedling pen under the eye, and then they end up with post-inflammatory hyperpigmentation. I see a lot in that area of the face is more prone to it than other areas, so just be careful with at-home microneedling, derma pens, going to your esthetician for under eye rejuvenation with some type of microneedling or derma pen, because more often than not, I would say 80% of the time, it can cause post-inflammatory hyperpigmentation, and then you're left with these like dark circles under the eyes. One more thing I wanted to mention is darker skin tones and skin of color with hyperpigmentation under the eyes. You have to be very careful with lasers because lasers can induce pigmentary alteration or hyperpigmentation. So you have to go to an astute clinician and laser specialist. Usually in my office, we can sometimes do pico or pico toning, not to get too scientific, but the pico laser is a photoacoustic, not a photothermal reaction because it's so fast. It's a picosecond, which is a trillionth of a second. So there's no dissipation of heat. So it targets the melanin, erases the pigmentation, but it doesn't cause post-inflammatory hyperpigmentation. In addition, you have to post-treat the melanocytes to stabilize them to make sure that they don't hyperpigment. So for my skin of color patients who have darker skin underneath the eyes, especially when that skin is thin and it gathers, like when you extend your elbow, your skin is thinner and it gets more collected there, so it looks darker, we'll do either a Clear and Brilliant 1927, Pico Way, Pico Toning, or sometimes we'll use other modalities too to help lighten up that skin, but we usually do it in conjunction with melanocyte inhibitors as well. I just took a red eye and just landed in LAX because it was spring break for my kids and we went on a surf trip, and I've been surfing all weekend. I literally just got off the plane and have not slept in over 35 hours. So I probably have dark circles under my eyes. Hopefully I don't, but it's an amazing phenomenon if I don't because I am exhausted and I have not slept. But I'm about to get to bed and wanted to get this video out for you guys because I don't want the content to stop coming just because I'm living my life and being a mom and on spring break on a surf trip with my kids. So hopefully you guys enjoyed this eye rejuvenation video. I just wanted to do this video because I've been getting a lot of questions related to my other videos of the under eye area, and this is probably, again, my most sought after treatment area for patients who I see every day in my clinic and in my office. Okay guys, on that note, we'll see you next week. Drop a comment in the comment section. Let me know what you guys want to hear about or any other questions that you've had. Share your experiences with one another on under eye rejuvenating treatments that you've had, because this is a safe forum. I'm non-sponsored. This isn't influenced by Big Pharma, and we're just here to exchange ideas and empower one another. All right, love you guys.